Hi everyone, Dr. Sam Gaston here at North Texas Sport and Spine, and today I want to talk to you about another one of the modalities that we have in the clinic, and that is going to be our suite of electrical muscle stim units and different therapies with that. So we've got the big unit to do most of the electrical muscle stim that we'll be doing in clinic, and this has multiple different electric modalities within it. So it can do the standard TENS unit, which is what we're going to use for people that are at a high level of pain where we just want to block the pain, take the pain level down a little bit so that we can do other therapies or treatments that if the pain level is high enough might be a little bit restrictive, or the pain might be limiting itself to those therapies. So the TENS unit, we just get the 4 pads on surrounding that area so that the 2 pads on one side and the 2 pads on the other side form an X on the area that's causing pain. And the way that the TENS unit works is pain travels on the slowest nerve fibers that we have. So that's the type C fiber. So we know if we can stimulate any other type of nerve with information, that can get to the brain first before the pain signal gets there, and you can block the pain. So with the TENS, we're just trying to stimulate the muscles of the area, put an impulse into it to overload the brain basically with feedback so that we don't get that strong pain signal instead. This unit can also do interferential current, or EMS, and what that's going to be useful for is any areas where there's inflammation, pain again, or just a spot that we want more stimulation to. The interferential will go a little bit deeper. It can have a sweeping effect where it actually pumps some of the inflammation out of there. So that's just another thing we can do with the unit to try to help treat various conditions in here. And then the unit can also do what's called Russian stim. So Russian stim becomes useful when we're trying to strengthen something, whether that's after surgery or just as part of the regular treatment. The Russian stim, how it works is it's going to force a very strong contraction in the muscle, and then we have the patient contract along with it as hard as they can. So it can go anywhere from 10 seconds to 20, 30 seconds, and then you're going to have a break after it. So we're trying to get maximal contraction, maximal muscle activation, and then relax after. So the current is going to stimulate every muscle fiber there, and then we want you to actively flex on top of it, and that's going to help us strengthen areas where we're having a little bit of trouble getting some strength in there. We also have different smaller units. This one here has the alligator clamps on it, and this is very effective when we combine it with dry needling. You get the needles in the affected area, you clamp the clamps here onto the needles, and that can allow for some deeper stimulation into some muscles where we've already got the needle penetrating it, and we want to get some more activation and stimulation there. We've also got the point unit here, and again, this can be used to touch the tip to the needle to get a little bit deeper stimulation in single spots, or you can just use it to get stim just on touch on a trigger point, something like that, where we want just specific quick stimulation into that muscle. So these are the electrical muscle stim units and some of the reasons that we use them in the clinic.